We are joined now by Chief Public Health Officer for Prince Edward Island. Dr. Heather Morrison joins us now from Charlottetown. I know this is such a busy time for you, so I really appreciate your time this morning. Thank you.
Nice to be here.
So it's got to be disheartening, PEI seeing its first active cases in more than 2 months. Are you confident that this cluster of 5 has been contained?
Well, certainly from what we know to date and the contact tracing we've done, we feel that we got a lot of our contacts or all the close contacts of these cases tested, and the results have come back negative. So certainly we're feeling a lot better today than we did a couple of days ago. And of course, we did a large amount of testing in the long-term care facility, both of staff and residents. It is certainly disappointing after going, I think, 67 days without a case here, but not unexpected. We're in the middle of a global pandemic, and certainly it reminds all of us that the risk is still present.
You say not unexpected, and I was wondering if this is the kind of thing you were expecting.
Well, I think we've been doing putting a lot of measures in place to reduce that risk, but realizing that all these public health measures we're doing and the measures we're putting in place, they're not 100%. And that's why it's important that no matter where we are, that we're following some of those measures around physical distancing, hand washing, and staying home if you're not feeling well.
You mentioned the testing at a nursing home. We know that one of the cases in the cluster is an employee of Whisperwood Villa. That's a nursing home in Charlottetown. Were there enough protocols in place to protect potential exposure to the residents in the home in this situation?
Yes, I mean, I believe there was certainly good screening, and they were wearing appropriate personal protective equipment, and the person identified very quickly that they weren't feeling well. So they've had those measures in place. We do not have anyone in PEI who works at long-term care facility to other long-term care facilities, so that is not permitted. And so those are the kinds of things that we're glad we have in place in this province.
I gather the home is now closed to visitors, I believe. Correct me if I'm wrong. And can you tell us about what kind of testing is now happening there?
Well, we're just completing any staff that may not have been tested on the weekend. We're trying to make sure that they're tested today. We'll also be repeating all the testing for the staff and the residents later this week. So they'll get 2 tests altogether.
Now, we do know from this cluster that none of the new COVID-19 cases are related to this so-called Atlantic bubble. It opened up this weekend, which means neighboring provinces there don't have to quarantine when they visit each other. So in this case, we know it began with a young man who traveled outside of PEI and had an encounter with someone who had recently been to the United States. Now, if there are more cases like this, though, do you think it will raise questions about the newly opened bubble and whether or not measures need to be pulled back a bit?
Well, I think it's natural to have raised those questions with something that has just started. But I think it's important to look at how well we can contain this outbreak here in Prince Edward Island. I think it's a discussion amongst the premiers and certainly my colleagues in Atlantic Canada. We still, in terms of Prince Edward Island, we still have screening at our borders, our interprovincial borders, whether it's the ferry, the bridge, or the airport. And we would want to make sure anyone who had been in the United States had self-isolated before coming to Prince Edward Island. So those questions will continue. And I think that's important, whether or not we're in an Atlantic bubble or not.
We certainly saw the long lineups, people so eager to not only bring tourism to these provinces, which I know is welcome, but also visit families. We heard people over the weekend say, I'm so happy I can finally go to my mother's funeral or visit a loved one who's in a long-term care home. But when we're looking at those lineups right now, you may have heard our reporter, Brett Ruskin, before our interview talking about concerns about essential workers having to wait for hours now to cross from one province to another. What is your assessment on how this first weekend of the Atlantic bubble went?
Well, certainly, I mean, I can speak really on the P.E.I. Side, and people who were coming into Prince Edward Island, actually, it went fairly smoothly, and they only had to wait a very short period of time, a few minutes. So that we had a number of lanes of traffic, and we actually had screeners even go on to the Northumberland ferries and do some of that pre-screening before they left the ferry. So I think for those coming into Prince Edward Island, it actually went quite smoothly, and the number of vehicles coming into Prince Edward Island certainly has dropped off significantly from that first day on Friday, and my understanding is that flow is working well coming into Prince Edward Island at this time.
What are you hearing from local residents? I mentioned tourism, and obviously some sectors will be welcoming anyone new, but we are hearing that there are some people, local residents, who aren't exactly thrilled with having more people and the possibilities for increased contact to the COVID-19 that brings. Are people welcoming the bubble, and from what you're hearing?
I think there have been mixed feelings, and I think I've said this a number of times over the last week, mixed emotions. You mentioned people are happy to see their family and friends that they haven't seen in a number of months, and there are a lot of connections between our Atlantic provinces. But there's also that anxiety and concern over the introduction of a slightly increased risk with more people coming into the province. And I think both those feelings are very normal.
Final thought from you. What is your biggest challenge right now as a public health officer? I'm wondering if it is a fatigue. The weather is nice. People are heading to beaches and cottages. What is your challenge as you plead with people to continue the same kind of measures that we were asked to maintain from months ago?
I think, I guess there are probably many challenges, but one is to try to balance what we know is important from economic and social, emotional connection that we have with others, but trying to really reinforce that importance of being vigilant about trying to protect yourself, but protect your family and protect others. And that is some of those same measures of really washing your hands, wearing non-medical masks if you can't maintain that physical distancing, keeping your circle of contacts smaller than you would have a year ago. So I think it's trying to make sure that people continue to hear some of those what I'm calling the basics in the middle of a pandemic, and recognizing that they do want that connection again too.
Appreciate your insights this morning. Thank you so much for your time today.
Thank you.
In Charlottetown, Chief Public Health Officer for Prince Edward Island, Dr. Heather Morrison.